Moving along with our legislative portion of this, we have somebody who wins the prize for the longest distance traveled. Um, from Alaska, we have the aide to is Senator David Wilson, who would have liked to have been here but could not make it. In his stead, he sent his aide Gary Zepp to talk to us about the efforts in Alaska. Senator David Wilson is in District D in Alaska, and Gary, why don't you come up and let us know what's happening in the furthest most portion of our country.
Thank you for putting on the conference, first of all.
Thanks for being here.
Yeah, thank you very much. It's been amazing listening to all the presenters, all the experts. I've been doing this for 6 months with Con, so, I really do appreciate all the insight, all the similarities that we face in Alaska. Some of the things are parallel that I hear. And I was going to bring up a couple pictures from Alaska, like bears and humpback whales and orcas, but I figured that wasn't pertinent. But anyway, good afternoon. My name is Gary Zepp. As the gentleman said, I'm legislative staff to David Wilson from Alaska. Senator Wilson sends his regards and his apologies for not being able to attend today. He had another commitment that prevented him from being here. I'm honored to be here today presenting on behalf of Senator Wilson and my fellow Alaskans. And it's actually good to be in the Beltway, back in the Beltway area. I was born in Baltimore, but I've been in Alaska for the last 43 years, so it's nice to be back in the D.C., Northern Virginia, Maryland area. A little background about the Alaska legislature. Alaska has a citizenry legislature, which results in our legislators coming from a variety of backgrounds: fishermen, plumbers, carpenters, laborers, biologists, accountants, you name it, it reflects society. And related to that, I feel fortunate to work for Senator Wilson because he's one of the few people, legislators in particular in the building, that has the health and social services type background. He has an MBA in healthcare administration and also psychology, one of his favorites. He served as a healthcare administrator for various nonprofit and profit organizations. And Senator Wilson introduced Senate Bill 62 in the Alaska legislature during the last regular session earlier this year. Senate Bill 62, if enacted, would repeal Alaska's con laws with a delayed 2-year implementation date. So this is the nuclear option. We've had one hearing in the Senate Labor and Commerce Committee where we presented, provided studies, and invited testimony from the Mercatus Center, George Mason University. And thank you to Mr. Stratman, who's not here, and but his staff is. They were excellent in their testimony this past April for us. And we're very excited to be here and hopefully connect with experts like yourselves that can help us repeal the con protectionism that we have in Alaska. It's fortresses versus frontiers. And we're continuing to work in our legislation to provide real data and expert testimony from folks like yourselves. So please, if you're interested in assisting us, contact me during or after the conference. We can exchange business cards, etc. We'd love that. As in many places, repealing the con laws is a huge uphill battle in Alaska, and probably as well as I'm hearing in the lower 48. In Alaska, we're kind of dusting off the last attempts. The last attempts were in 2008, and so it's been a while since Alaska has tried to repeal their con law. The lobbying efforts of large healthcare providers, the State Hospital Association, and the Nursing Home Association are powerful opponents because they flood our Capitol building and persuade legislators that repealing Alaska's con law is bad for our citizens' health care. I've attached a slide deck, I don't know if it's up or not, but from the Alaska State Hospital Association and Nursing Home Association, and I'll just quickly show you here. It's pretty easy to understand here, but this, we presented in committee, and they presented right after us. And this is one of our favorite slides, and this slide shows, this slide shows a picture of the United States, every state in the nation, and the issue is rural hospital closures since 2010. And it gives the number of hospital closures in each state. And when I first saw this, I thought, oh my God, this really helps me a lot, because that's a big fear in Alaska, rural hospitals. So, however, this slide to me, was a scare tactic to legislators on the committee and also to the public listening in. Um, the slide shows 17 total rural hospital closures since 2010. And it's very sad indeed. No one wants to see their local hospitals close. Nobody. However, I did go back after the hearing because I was curious, and I compared the states that had rural hospital closures and compared that to the National Conference of State Legislators data so I could tell which states had con laws and which states did not that had rural hospital closures. To my surprise, of the 23 states that had rural hospital closures, 17 were con states and 5 were non-con states. What does this mean to me? Nothing. But this is the fear-mongering that I face in the Alaska legislature. Whether a state has a con law or not doesn't seem to matter. But again, this is part of the argument and the fear that proponents of con laws use when they're trying to convince legislators why we need con laws. Protectionism. In Alaska, we have rural community hospitals, and legislators are persuaded that we need con laws to protect them. There is a fear that if we repeal Alaska's con laws, there'll be a flurry of cut-rate healthcare facilities that will crop up in their communities and drive their rural community hospitals out of business. Some of the other concerns expressed by con proponents in Alaska is that if our con laws were repealed, again, cut-rate healthcare facilities will start appearing, and I've heard this term a lot, cherry-picking services. The fear is that this would threaten a hospital's ability to cover their indigent care, the uncompensated care that is typically covered by private insurance payers who pay a premium for healthcare services to subsidize the indigent care. Healthcare costs in Alaska are very expensive. I'm going to go to Oklahoma next time I need healthcare. I've heard this several times. An example that we've heard in our initial research is knee surgery. In Alaska, the cost could approach $60,000 plus. In Seattle, which is the closest, largest community to us, the same service is approximately $26,000. And so this has caused healthcare tourism, if you will, to Seattle, because a lot of folks leave Alaska to go somewhere else because the costs are cheaper, the healthcare quality is better, and it's a shame those dollars are leaving Alaska. And so we believe a free market where consumers are empowered and have choices will help reduce those costs in Alaska for healthcare. Again, very excited to be here today before you, and we're looking for assistance, support, and guidance in helping us prepare for our hearing in January 2018 and our efforts to repeal Alaska's con laws. Over the summer, I'd like to converse with folks who want to testify or support either in person or via telephone before we have our next hearing. We need national experts like yourselves to get over the hill. We need good data to prove our case before the Alaska legislature. In our research in Alaska, we've discovered that many healthcare providers, doctors, nurse practitioners, and others that testified in 2008 in support of repealing the con have declined to testify now. They fear retaliation from the large providers that could result in a loss of hospital privileges. They previously felt intimidated, followed throughout the Capitol building, and one doctor was concerned about his safety. Now that we're having difficulty getting Alaska healthcare providers to testify in committee, even though they support the repeal of the con in private conversations. We've examined historical and current arguments for con laws. They do not provide an economic justification for depriving Alaska consumers of the benefits of a free market healthcare system. Alaska's con poses a substantial threat to the proper performance of healthcare market and services. And I don't know if there's a slide deck or not up.
It should be up.
Oh, there we go. Okay, there we go. So I'm not going to read these to you, but I want to just kind of give you a quick summary. I just pulled some of these slides out of our presentation from April of 2017. This slide, two here, Alaska, like other states, we enacted our con laws in 1976 with one of the intentions of controlling healthcare costs because they were spiraling out of control. Alaska's con law requires a $1.5 million threshold to construct, remodel, or purchase equipment for a healthcare facility. Any time at this level or above requires government review and approval. And in Alaska's system, Alaska has an administrator that recommends approval or not to the Commissioner of Health and Social Services, who has the final say. Alaska, like other states, has a long history of con law legislation, bills, and hearings. And as I mentioned, 2008 was the last time that we attempted to repeal in Alaska. Unfortunately, the bill died in committee. And as I mentioned, Alaska's healthcare costs are outrageous compared to the lower 48. And we realize the con laws are not just about the cost, but that aspect of the con has failed, along with some of the others. And the con laws in Alaska have not worked. We have examples of applicants seeking a con approval, and with that $1.5 million threshold, in one case in particular, the applicant's costs, because they were bringing equipment in, exceeded that. So what did they do? They sold their expensive state-of-the-art equipment and bought lesser quality equipment in order to stay below the $1.5 million threshold. So the system's manipulated. You have appeals by competitors that shut you down, tie you up, cause legal fees. Not to, again, we're trying to get quality health care in Alaska and also in America here, and it just seems unbelievable. We'd like to recognize and thank several huge supporters that helped us in our initial April 2007 Senate Labor and Commerce hearing, such as the Federal Trade Commission and the U.S. Department of Justice Antitrust Division for providing a letter of support for Senate Bill 62. Unfortunately, it came after the hearing. So we'll use that in January as one of our starting points. But the Mercatus Center, George Washington University's Mr. Thomas Stratman and his staff's testimony was spot on. It was great. And also, Mr. Robert James Samasi provided us a tremendous amount of research. I don't know if you folks know him or not, but, and then lastly, Senator Wilson and I would like to sincerely thank you all for the opportunity to present today and want to encourage you to support us in defeating Alaska's con laws. We'd love your support and assistance in this effort. Again, I'd like to thank you all.
Gary, thank you for making the trip here, and I hope that this was worth your
It was invaluable.
time.
It was invaluable.
So what kind of help are you actually looking for?
Sure. One of the things that I think is interesting, and I was talking to Kathleen about this, is the presentation at the State Hospital Association and the Nursing Home Association, as an example. You know, one of the things they threw out was that slide number 3, where they talk about the rural hospital closures. To get these legislators to fear that if I vote for the con repeal, I won't get voted back, and I'm going to close my local rural community hospital. And it doesn't work that way. All the research that we've done through Mr. Stratman and everything else I could get my hands on to read, there is no evidence that occurs. None. But it's that fear-mongering, I think, that in these legislators that makes them hesitant to vote for it.
So have you written things in newspapers in Alaska, any op-eds, or have there been any effort on the part of, looking to generate public support for this?
Not yet. We had one hearing so far, and then, like I'd indicated over the summer, as soon as I get back, we'll start ramping up again and try and reaching out to some of the folks I've already talked to, exchange business cards, and because I'm hearing a lot of similarities that you folks face. And again, I think you can present a better case united than you can divided.
Sounds like you need some hired guns. Road trip to Alaska.
Come on up. Come on up. I'll take you out on whale watching and fishing tour.
Okay, we'll take you up on it.
All right.
Thanks
Thank you,
again,
folks.
Gary.
Thank you.
Good.